A very good morning, everyone. It is time for our Good Morning Pagosa show, and it's the fourth Friday already of October, so we feature the Pagosa Springs Medical Center on the fourth Friday, and Dr. Lauri Medina and Jason Webb are here. Good morning, you guys.
Good morning.
Good
Welcome.
morning.
And Dr. Medina is in general surgery over there at PSMC, and you've been on the radio. I was over there at the hospital last time we met. And Jason Webb, you've been here a lot,
Yes, sir.
EMS director. So thanks for dropping by early this morning. And even though you've been on the radio before, you want to maybe give us a brief introduction again, Dr. Lauri?
Sure.
Okay.
So I'm Lauri Medina, and I've been a general surgeon for quite a while, longer than I'd like to admit. And I've been fortunate to be helping Pagosa probably for about 7 years, we figured out. And recently the opportunity presented itself for me to be down here more, which is very exciting, joining Dr. Roy Tingley, who's been here for several years and has really built the program. So it's a wonderful place to be and a great community to serve.
Yeah. And Jason Webb,
You can call me Doctor.
EMS director. Tell us again about yourself. You came down from Denver, right?
Yeah.
Yeah.
So I've been doing EMS a long time as well, longer than I'd like to admit. But I've been in Pagosa since 2011. I come from the Denver metro area where I learned to be a paramedic and then came down here. And I currently serve as the EMS director and the hospital's liaison for PSMC.
That's a busy place. We have a scanner upstairs, and it's just constantly going. Even early this morning, I heard something going on.
Yeah.
So anyway, I'm glad you guys are here.
The siren always turns, man.
Right?
It always
yeah,
turns.
Seriously. Right? So we're going to talk a lot about general surgery, right? And Dr. Medina's role, right?
Yeah.
And you guys are a team, and so the trauma thing and everything, you guys work together, and it's thank you so much. It's really crazy.
Yeah.
Good, benefit for our community. We've watched the hospital grow, and now we have all these services. So, Dr. Lauri, you want to tell us more about that?
Sure. One of the exciting things that I hope to bring here to Pagosa is an expansion of different types of services for everybody, but in particular promoting breast services. The hospital has state-of-the-art diagnostic material or diagnostic equipment to help women stay healthy from a breast health standpoint. We have a fantastic radiologist, Dr. Jessica Cox, who can do everything here pretty much that can be done in a bigger city. And she and I tag team, all different kinds of cases. We collaborate as to best approaches, and we're able to deliver very precise and personal breast care for women at Pagosa.
Mm-hmm. Yes. And October, is that Breast Cancer Awareness Month or something?
Yes.
So
we're
winding down, but that's important. And so people can make appointments with you. Is that how they call the hospital and get that set up? Or
most of the time when you're going to see a general surgeon, usually you're referred to them by another provider.
Care person.
There probably is some circumstances in which you wouldn't directly be able to see a general surgeon, but most of the time it's through some other physician. Yeah. And so if there's a service that Dr. Medina talks about today that you're interested in, talk with your provider, your primary care provider, and they'll definitely refer over if they feel that's a good fit for you. Otherwise, we have our normal number. If you call the hospital at 970-731-3700, there's a prompt that you can schedule appointments with any of the physicians, and that is your easiest way to do that.
Right, and I found out you can go to the clinic, too, and get started that way, possibly. You can meet some of the primary care physicians there because they kind of have a rotation, I guess. Is that how that works at the clinic?
Yeah, so they have the clinic has a walk-in clinic, is what they call it. So it just basically means you don't have to have an appointment to come there. I will tell people, though, that doesn't mean you don't wait, because everybody comes and we kind of triage the problems and work through them. But you are able to show up at the clinic between the hours of 8 and 4:30 and see a physician. And then it also includes our specialists sometimes, depending on what your issue is.
Right.
One of the exciting things about being at Pagosa is that we are small enough that all of us collaborate very closely together. You are able to go from your primary care provider, oftentimes walk across the hall, and if there's a service that's needed, we can oftentimes provide it same day. Not always, but oftentimes, or at least get you set up for the next step. The walk-in provides a fantastic service, and at the same time, we also encourage people to really establish care with a primary care provider, just to make sure they've got all the boxes checked in terms of keeping you healthy for the long term, making sure that all the different preventative services that we offer, such as colonoscopy, which both Dr. Tingley and myself offer, that those boxes are all checked, and you're able to stay at your healthiest, enjoying all the great things that Pagosa has to offer.
Right, and the clinic is open Monday through Friday. I think is it 8:30 to 4 or something like that?
Correct, yeah.
Yeah, okay. But otherwise, yeah, call, make an appointment. And colonoscopy, yeah, it's, they're recommending those for over 50 now, is that?
Actually, a few years back, they dropped the age. It's now recommended starting at 45, or if you have what we call a first-degree family member, so a mom, dad, brother, or sister that had a colon cancer at a younger age, the recommendation could be even younger than that. Again, we really work on personalizing your health care for you. It's not a one-size-fits-all. And, of course, depending on if you have any concerning symptoms, any changes with what we call your gut health, certainly don't hesitate to bring it up to your primary provider, and they will work with us to make sure you get steered in the right direction.
Dr. Lauri, what do you think about these little boxes that you mail in? Or
the data is very good on those, good? And certainly,
and check.
Yeah, they're not for everybody. There's certainly certain individuals that don't fit the criteria for that. But if I always say it's better than not doing anything.
Cologuard, is that what it's
Yeah, and it really is a good option. And there's certain situations when I will certainly recommend that for people too.
Yeah. Interesting. So, what else? Oncology, maybe?
Yeah.
Right?
So we're very fortunate to have an oncologist, Dr. Andrew Buck, that's there, and he has a fantastic nurse practitioner, Kelly Chessery, and again, we communicate with these individuals on a weekly, for sure, if not a daily basis, depending on the situation, and the services, while even if you had to go to a bigger place, whether it's to get a diagnosis or your treatment started, a lot of times that treatment can be completed or maintenance therapy can be carried out at Pagosa. So again, we can help support you throughout the course of dealing with this really challenging situation close to home, so you can be around your friends and your family and not have to be living in a hotel somewhere else. So it's really an exciting opportunity for people living here.
And who was it we spoke with over there, and I got a tour of that huge, is it James?
James with the MRI?
The MRI, that machine is really impressive, and just I'm thinking of some of the photos that I was seeing of, patients, but not names given, of course, but it's just incredible what it can focus in on, that MRI machine.
For a small hospital, we really have the ability to deliver top-notch diagnostic services for people. And technology is such that right now that we can send a lot of these images, to Denver, to Colorado Springs, to wherever you need to get your care. And again, for most of us, we want to be in our own home, particularly if we're sick. So the longer, we can stay there and around our support systems, which is so important in helping us all get better. And I think Pagosa has done a fantastic job of building up their services to support the community that way.
It's so true. I mean, that drive to Durango, it's just, I've had to do that a few times just for other business, and it's just,
It does wear on you, right?
It wears on you, and the deer jumping in front of you and all that. It's a little scary, It's
It is.
Whoa.
Then you end up getting to know Jason and
Right.
his team,
The
unfortunately.
trauma team.
Yeah.
You don't want to meet me.
Right. It was an obstacle course the other night, and one guy in a big truck had hit an animal, and it was like he was off to the side of the road, and the police officers just got there, and that's the kind of thing you deal with
Every day.
Every
That is
day.
a common scenario that we deal with every day.
Yeah, this time of year especially, right, with the
Absolutely.
movement.
I did want to make one point about what Dr. Medina was talking about with the diagnostics care. All of those are accessible even if you do not have a primary care at PSMC. Your physicians can place orders in to use all of our diagnostics that we have. So that's MRI, ultrasound, CT, X-ray, the mammograms, bone density. So all those diagnostic images, as well as our lab, is available. So our services are available even if you do not use our primary care.
Yeah, there's a lab where they mix concoctions for maybe that's oncology.
Yeah, an infusion center. Yeah.
Yeah,
Mhm.
infusion center. That's it. So just all kinds of.
Yeah, our infusion
Wonderful.
center is part of our pharmacy, and so they're able to actually build compounds specific to what the scenario is for the patient, and those can be delivered within our center as well.
Mm-hmm. So while we're on that subject, trauma care,
Trauma care is where I get to work with Dr. Medina the most.
Yeah.
So
okay.
I think that's
like
a
I
fair
said, you
topic
guys
to
are a
talk about.
team. The whole hospital is a team, but this is an important, part of the teamwork.
Yeah, absolutely.
Trauma care.
Yeah, absolutely. So in any trauma system, usually the general surgeons are the ones that take the lead a lot in trauma care. And it starts out in the field with EMS, and we have a very integrated, organized system that keeps our physicians like Dr. Medina informed as in terms of what is coming into them, preparing so that whatever intervention she's going to do in the trauma bay, she's ready for. And that's coordinated through EMS and the ER and the surgical team. And that is available most days at the medical center as well. We're very, very lucky to be in a small community and actually have coverage of any day, let alone, I believe we cover 20 days, I believe is where we're at right now, a month, where we have basically the same type of trauma team that would occur in a larger city here in our small town.
Yeah.
And I think one of the things that's really challenging here, doing what Jason does, is we are in a very remote situation. So oftentimes when people get in trouble with, an ATV or on a mountain bike or something happens on a hike, you're not around the corner and it might not be accessible. So Jason and his team really go above and beyond maybe what a big city team that is within the transport time average in big city is 8-10 minutes, something
Correct.
like that.
Yep.
Here it might be 8 or 10 hours. So these guys and ladies do an amazing job of stabilizing and supporting individuals that might be quite a ways from our hospital, and as well as getting people out of some pretty tricky situations in all kinds of crazy weather too. So really,
Far out there.
yeah, hats off to them and their team and the amount of training that they have to do to keep up those skills because, again, it's above and beyond being in a bigger city where there's a hospital around every corner. So we're very, very fortunate because they show up to us in pretty darn good shape.
That's amazing when you think about all the roads and the mileage that
It's
you
a long
cover and
ways,
the
man.
dirt roads and the back roads and
Google Maps doesn't always work. I bet,
No.
right?
No.
Yeah.
Usually it does not work.
Yeah, it's landmarks as the whose car is up on blocks and take a right there. And,
Yeah.
oh yeah.
The tree that looks weird down
The
at the
tree
corner
that
makes left.
Right. Right.
And I know we're always proud to talk about the ambulance service that is hospital owned.
That's right, which we're super proud of it. We're one of, I believe it's 6 or 7 that are still hospital owned, which years ago they used to all be hospital owned, but many of them moved out. They're very difficult to make money with, but we still have kept ours within the hospital system, and we're very proud of it. And I like it the most because I have access to physicians like Dr. Medina. If I were working another type of system, I probably wouldn't. I would just have access to my medical director. But any of the specialists at the medical center are very involved in our EMS service, and that's why I think we are able to deliver what we're able to deliver.
And again, we keep coming back to this theme, but just the close collaboration, and we all work together so closely, and it doesn't matter whether it's radiology, surgery, and very importantly, our fantastic cafeteria people that keep us all going and provide amazing food. Yeah, it's great food. And but it's really a very integrated team with everybody supporting everybody else. And again, the person that wins is you from your healthcare standpoint. And it's very exciting to be a part of that. So.
Well,
the other piece I wanted to add
Yes.
is if you just walk in the front lobby of the hospital and you look up, there's all kinds of banners up there of different awards that the trauma service and our trauma nurse coordinator, I believe,
Yep.
is that
Our trauma nurse coordinator, yep.
Yeah, Mimi Fox has won, and so I think the community should feel like they're in really. Hopefully, you don't have to meet any of us, but if you do, you're in really good hands.
That's right.
Very good. So, good morning, Pagosa, and we're speaking with Jason Webb, the EMS director, and Dr. Lauri Medina, general surgery over at Pagosa Springs Medical Center, 970-731-3700. We're going to take a quick break and visit with our sponsors of Good Morning Pagosa, Homespun Hot Tubs, ChemDry, La Plata Electric, and Pagosa Springs Medical Center Behavioral Health. We'll be back in just a couple of minutes. All right. Thanks, Marcia, and everyone at Pagosa Springs Medical Center. The care you deserve in the mountains you love. And we're live right now with Dr. Lauri and Jason on Good Morning Pagosa. Thank you guys for dropping by. Anything else you want to cover this morning on our show?
Yeah, we just want to encourage everybody to really be proactive in taking care of your health, not just the usual things as eating right and getting outside and moving and enjoying this wonderful place that we all live in, but also going ahead and signing up for some of the tests that we might not all be that excited about, such as things like colonoscopies and mammograms, because there's always the scary piece that we wonder, gosh, what if something's wrong? Well, the good news is most times there is nothing wrong, and you walk away with a clean bill of health. And if something concerning is detected, we can act on it in a very quick way. Healthcare right now has become very overwhelmed, but one of the things at Pagosa is we have the ability to act on whatever concerning findings there might be in a very quick way, both within Pagosa as well as collaborating with other institutions around the state. And again, the person that comes out on top with that is you. Again, we can get you connected with our cancer center if that is a finding, and you can get connected with them even before you have to move on to other next steps, and you'll find a lot of support there as well. So again, just really encouraging everyone to be very proactive, to stay healthy, and not just wait until something is really seriously wrong. You'll be really happy you did it.
Right, yeah, because they can just cascade, and you've got multiple problems, and then you got to deal with them all, and take care of things before that happens. Right, and you can sign up and get an appointment with the primary care folks. I'm just looking at the roster on Pagosa Springs Medical Center.org. It's just amazing all the people you have.
It's added a lot of people.
Look at all these people, and they're great people.
And we really have specialists. They might not be at Pagosa all the time, but we can, again, it's a small enough team that we can collaborate with you and with them to get you seen just as quickly as possible and move forward a lot of times much quicker than in a bigger city where you can have 3 and 4 month wait times before you're able to get into different specialists. And one of the things Dr. Tingley and I can do is we can address a lot of issues that typically in a bigger city would need to be addressed by different specialists, like dermatologists, for example. And I know the wait times in some places for dermatology can be months. So we're happy.
Long time.
Yeah.
So you do that too. Dermatology is.
Well, I wouldn't say we do dermatology, but we help certain procedures. Yeah. Suspicious moles. Funny looking things that you're not sure what to do. We can take a look at and help you with. So yeah.
Will, I wanted to make one more point too.
Okay.
Sometimes cost, or people are worried about what this is going to cost, and you were
Right.
talking about all the faces that are on the website, and I wanted to also point out we have a financial team, financial counseling team that can help look at whatever your specifics are, whether you have a typical kind of plan or whatever that may be, and the idea is to try to work with you and try to figure out how we can achieve all the procedures and the various parts of healthcare that the physicians are recommending for you. We also have that team at the medical center, and I encourage people to use that because cost shouldn't be a barrier. We would try to figure out ways to get over that.
Yeah, that's a good point. I saw that on the website too in the beginning. Yeah, financial planning or whatever. Yeah, so thank you. Awesome work, you guys. And we're just about out of time, so just want to thank you for everything you do.
Thank you, Will.
Well, thank you.
And we're so proud of our hospital. You guys weren't here back when there was nothing. I mean, not even hardly a clinic.
Yeah.
It was just 24 years ago.
We're very lucky.
You know what I mean? Now we've got this beautiful hospital and all these amazing doctors and specialists. And so anyway, appreciate all that you do.
Thank you.
And thanks for
Thank
dropping
you.
by, especially this morning on a busy Friday morning.
Well, thank you so much.
Have a great day and a wonderful weekend.